morning. It's great to be here. My thanks to Surya, TIA, CREF, Penn for the opportunity. This is my first PRC, and I also take up the challenge they've given me in coming right after the legendary Laura Carstensen and being the barrier from you and your trains and planes. So really, it's a great pleasure to be here. From my understanding, this is one of the first meetings where there's been a global focus. And I'm particularly grateful for that because I think there's an incredible amount of white space in the global aging field to make an impact both from a policy and programmatic point of view. So today I'll talk a little bit about our perspectives as it relates to policy progress on the UN Decade of Healthy Aging. You might be sitting in your seat and saying, why is AARP talking about international? And many folks in the room will be familiar with AARP, but not so much our international work. So I wanted to, if you'll indulge me, spend a few shameless slides and minutes on talking about AARP and some of our international work. So first, a big thanks to our partners. On my team, I report to Peter Runlet. He's the head of AARP International. We ladder up to Deb Whitman, who many folks in this room are familiar with. And then our research partners, Foreign Policy Analytics and The Economist Impact. So what is AARP? For folks that don't know, we're the world's largest nonprofit, nonpartisan organization, have about 40 million members. We're formed about 65 years ago. Many folks in this room will be familiar with our domestic work here in the US, less so on the international, but we have been engaged internationally since our founding because we have this firm belief that good ideas have no borders. And we take our theory of change internationally has been from partnerships, convenings, and generating new insights. And so from partnerships, I did want to flag, especially I know there's a lot of development finance institutions in the room. We have partnerships with the following organizations. With the World Bank, we've commissioned 2 reports under the leadership of Mamta Murthy, looking at the role of development and demographics. What we're hearing from the World Bank and DFIs is that many of their client countries around the world are coming to grips in terms of shifting demographics in their countries, and as a result are requiring more technical assistance. And so we've supported a line of work looking at this intersection between the economic ROI from investing in cities, communities, and governance as it pertains to population aging. With the Inter-American Development Bank, we've done a new line of work looking at gender and women's economic empowerment, especially in Latin America and Caribbean. With OECD, we've done several years of work looking at labor workforce and retraining and upskilling. With the WHO, we've led on age-friendly cities, and with the UN, of course, Amal has been an incredible partner, and we've had ECOSOC status with the UN since '87. We also have an AARP journal that I would put a plug in for folks to come and contribute. We try to lift up key areas of opportunity from global thought leaders in WHO Tedros and looking at age-friendly systems, the Decade of Healthy Aging, and Vivek Murthy's, the past US Surgeon General looking at healthy aging. And then we do original research, right? You know, with PAHO, Pan American Health Organization, we've funded a line of work looking at low-cost, scalable innovations to support healthy aging in resource-constrained environments. And then we have this initiative on the Aging Readiness and Competitiveness Initiative, or ARC, where we look at specific themes as it relates to healthy aging and then provide scalable, innovative solutions that are going on outside the US that can be applicable here within our borders. So the bulk, that was AARP, that was the plug. So the bulk of the presentation, I want to focus on some of our work tracking the UN Decade of Healthy Aging's progress at the country level, both from the WHO and from some of our independent work. Fortunately for us, and Amal may have alluded to this yesterday, the WHO is actively tracking policy and outcome progress. This is a graph looking at country progress in terms of percentage of countries that have, sorry, how do I go back? Green. Okay, sorry. What you have on the Y is 10 outcome indicators And what you have on the Y is the percentage of countries that have had that particular indicator in 2020, which was the launch of the decade, and then in 2022, 2023, their latest outcome progress, where countries are. Countries are doing quite well. They surveyed 194 countries. They had about a 70% response rate. 136 replied on an online questionnaire. And then they tracked in terms of focal point or having a national action plan on aging, or number 4, age-based discrimination. And they were tracking whether a country had a policy, a piece of legislation, a regulation, or an actionable outcome or objective as it related to these 10 indicator outcomes. And what we find is, or what they found, the WHO, is that the greatest progress in any legislation strategy at the country level was for policies around assistive devices, age-friendly cities, age discrimination, and comprehensive assessments. As you can see, the laggards in terms of their indicator outcomes is around data, which seems to be an omniprevalent problem in these resource-constrained settings. Around the same time, independently, we set out in terms of producing our own type of database tracking indicator outcomes as it related to the UN Decade of Healthy Aging. But we extended it beyond the UN Decade of Healthy Aging to look at where countries were as it pertains to 3 governance frameworks for healthy aging. One was the Madrid International Plan of Action on Aging, one of the oldest international frameworks or instruments that promoted healthy aging at the country level, and the Decade of Healthy Aging, which had the 4 relevant action areas. So we tried to create a database where we had, at every country level, an action plan, and tried to interrogate the action plan based on the indicators that were outlined across both the Madrid International Plan of Action on Aging and the Decade of Healthy Aging. So as you can see, there's 18 key themes, from work and labor to rural development, to mental health, to HIV, to supporting informal caregivers. And what we did is we charted for every country where those countries were as it pertained to these outcomes, or to these themes, I should say. And we said a country had that particular theme mapped if we were able to identify at least one policy-related actionable objective or plan. And the idea why we focused on national action plans on aging is that these are governance blueprints. These are 10-year roadmaps for countries to support a policy environment, the regulatory environment, the legislative environment, to ensure equitable, healthy aging for all of their individuals that are 50 and over, 65 and over in this case. So as you can see, there's some certain countries such as Portugal where they were able to have 16 out of 18 themes that were mapped. And then you had Chile that were 10 out of 18. And that goal here wasn't to name and shame, but was to get an idea of what were the gaps and opportunities for these countries to do better. We also looked at the alignments of these national plans within the international frameworks by issue area. And what we're able to see is when mapping out these 18 themes across these countries in the database, that the most prevalent theme was NCD prevention. Most countries, or a larger share of countries, had legislation or policies around non-communicable disease prevention, training healthcare professionals and care providers, and perhaps most relevant to this group, social protection and financial security. The plans in our database were least likely to address themes of HIV, AIDS, emergency response, and disaster planning and disability. Furthermore, 64% of the plans, and these 2 points are really critical, because it's not what we found internationally is that it's not just important to have a plan, you need to have a budget to implement that plan, and then you have to have monitoring frameworks to then ensure progress. 64% of plans that were included in our database did not have existing indicators for tracking progress, and only 36 had a particular budget allotted for that implementation. So when we're thinking about healthy aging, when we're thinking about policies for healthy aging, these are some of the critical elements that we've been able to uncover from our work. The policy dashboards are gaining more and more progress at the regional level. UNECE, the Economic Commission for Europe, has just released an aging policies database, and the idea is to promote good governance and good age-responsive policies at the country level, in this case, within the European Commission for Europe. Similarly for ESCAP, the Economic and Social Commission for Asia and Pacific, AARP has been a proud supporter of both of these data dashboards in terms of providing some funding support to ensure better technical assistance and knowledge capacity in these regions. Stepping back for a moment, the UN Decade of Healthy Aging, at its core, is to address inequities in healthy aging and to ensure that every individual has the opportunity to age healthily in a healthy manner. Understanding this and understanding some of the drivers of health inequities in low and middle income countries has been a real passion for ours and a real motivator for a lot of our work. So as part of our Aging Readiness and Competitiveness Initiative last year, we released a report on some of the key drivers and enablers of health inequities in these countries. And so, I know I'm running out of time, but bottom line for this slide is we know, regardless of development status, women tend to live longer, tend to live in more years of poor health, tend to live in more years of financial insecurity. And regardless of development status, there are more women that are informally employed than men. Furthermore, we interrogated using available data from the World Bank, WHO, and ILO, International Labor Organization, that if you look at the population covered by at least one social protection benefit or receiving a pension or vulnerability in terms of social assistance, there remains substantial gaps in the coverage and advocacy of social protection systems, particularly in low-income countries and low and middle-income countries. Just 2 weeks ago, we released our 5th version, our installment of our Aging Readiness and Competitiveness Initiative, this time looking at social pensions and what is the ROI, the economic ROI, what's the economic case for countries, especially low and middle income countries, to invest in their social pension schemes. I think we were one of the first to start in this brief that was released, and it's public, to link annual GDP, not just with life expectancy, but to Laura's point, healthy life expectancy. And we're able to show that 5% annual GDP increases associated with 15 additional extra days of disease-free life. We've conducted a meta-analysis of 3,000 studies looking at examining economic and health impacts of social pensions. And lastly, the insights brief covers, via economic modeling, the macroeconomic impacts of social pensions in South Africa, which is the oldest and longest running pension program. So I encourage you, I know this is not the focus of this session, but I encourage you to take a look at that. I'm happy to talk about that a little bit more. I'll just close with 2 thoughts regards to the UN Decade. It certainly has been a positive force, right? It was released during COVID, and if you look at news stories, there are non-traditional news outlets, conveners, policymakers, both at the Ministry of Finance and Ministry of Health level, that are thinking about healthy aging. One of the things, if you look at Africa, you look at areas of the world that are experiencing youth bulges, they're not necessarily thinking about healthy aging or older adults. Why? It's not top of mind. What we're trying to do at AARP is make a business case, a moral imperative, and a policy case for investing in older adults today to then reap the benefits in the future. And I know that's been covered in a couple of other sessions. So it has been a positive force. I will say we held a conference in Washington, D.C. about a year and a half ago. And you have we interviewed Natalia Kanem out of UNFPA. We had Mamta Murthy. We had all these development finance leaders in the room. And it was incredibly gratifying for us, I should say, to hear from them for the first time. Yes, at the World Bank, we're interested in healthy aging. We're going to invest in X, Y, or Z manner. And we had Susan Rice, who was the keynote, talking about why the UN should create an older adult agency similar to UNICEF. Times have changed for sure, but it's gratifying nonetheless. I'll close by presenting some interesting data that we collected about a year ago, where one of the questions is, and especially pertinent now, does the US care about what's going on abroad? Do we actually care about the best practices, policies, innovations that are going on in countries outside the US? And so we conducted a poll. It's very similar to this idea of the percentage of US GDP going to foreign assistance, or the US budget going to foreign assistance. And there's a misperception there. And what we found from our results, there's a misperception here as well. Going into this nationally representative survey, we thought it was a risk, right? We didn't know what to think. We thought maybe not many Americans were interested in learning about what's going on. So we conducted a nationally representative survey across political ideology, race, socioeconomic factors, the whole yard. And what we found is that the US healthcare system ranks very well on quality and access, but not so much on affordability. And the US is compared to other countries, from our survey respondents, has very good quality, but the cost is quite high, and it's not accessible to all racial ethnic minority groups. But what really surprised us, the first two data is not so interesting, but what really surprised us is the 50+ population in the US want to know what's going on abroad, and they've expressed a strong desire to learning the practices and innovations that are going on abroad. They might not know what the UN Decade of Healthy Aging is, but they recognize that the US healthcare system, as they age, is not ideal, and they want to learn about solutions that are going on abroad. And so, of course, we're doubling down on this data point, convincing stakeholders here in the US that we need to tap into this idea of reverse innovation when it comes to just policies, programs, and innovations. So I'll close there. I thank you for your attention and looking forward to the discussion. Thank you.